listening to Living with ADHD and CPTSD, available on Apple and wherever you get your podcasts.
Hello everybody and welcome to another episode of Living with ADHD and CPTSD. Today we're going to talk about the relationship between complex trauma and chronic pain and discomfort, like all forms of discomfort with chronic pain. So it's not exactly something that I have talked about before, and it is not one of the more common symptoms that is discussed out there in the real world, whether it's online in an article or even in any kind of like video that I've watched. I haven't really seen a whole lot of thorough discussion regarding chronic pain and then coming relationship with childhood trauma or CPTSD. So I have an article that I'd like to read. And here's the thing. CPTSD and PTSD have very similar setup, kind of relationship or, problems and symptoms. So they are extremely similar with obviously the differences, of course, that I have explained and you can find out for yourself. But chronic pain can occur with either, like post-traumatic stress disorder or CPTSD, you can have chronic pain. So either one. So just to realize that it is occurring in both people who have both CPTSD and PTSD. Okay, just so you're aware of that. All right, here's the article. How is psychological trauma linked to chronic pain? This article takes a look at the link between trauma and chronic pain. Discussion of types of trauma and the effects of trauma are included. And, please read with care if you are vulnerable. So obviously, that's a warning to my audience as well. The research available indicates that while trauma may not directly cause chronic pain, it certainly makes people more vulnerable to developing chronic pain. There are many studies which link chronic pain to trauma. The Institute for Chronic Pain states that up to 90% of women with fibromyalgia and up to 60% of patients with arthritis report trauma at some stage in their lives. As a point of comparison, people with chronic pain typically have at least double the rate of previous trauma as compared to the general population. The U.S. Department of Veterans Affairs explains that 15 to 35% of patients with chronic pain also have post-traumatic stress disorder. Let's explore why emotional trauma is so deeply linked to chronic pain and what we can do about it. What is trauma? Before we can understand how trauma is linked to chronic pain, we need to understand what trauma is. Trauma can be defined as an event, a series of events, or a set of circumstances experienced by an individual as physically or emotionally harmful or life-threatening, with lasting adverse effects on the individual's functioning and mental, physical, social, emotional, or spiritual well-being. Essentially, a traumatic event is one which is potentially life-threatening and which overwhelms the body's natural coping mechanisms. Now remember, CPTSD is repeated chronic trauma on an individual. So it's similar, it has its differences, but also the similarities to PTSD. Anybody in any area of the world, of any gender or age, can experience trauma. Trauma does not discriminate. Traumatic events can include an accident or medical trauma, sexual or physical abuse in adulthood, physical abuse or neglect in childhood, being in a combat situation, and natural disasters. As a result of trauma, individuals may suffer from a range of mental health conditions, including anxiety, depression, post-traumatic stress disorder, and complex post-traumatic stress disorder, and dissociative disorders such as dissociative identity disorder if the trauma was repeated in an early childhood before the age of 6. The link between mind and body. We know that our mind and body are connected. They can influence each other in many ways. We also know that stress and pain create a cycle, perpetuating one another. There are many ways in which stress worsens pain, including causing tense muscles and increasing inflammation. Trauma and unresolved emotional issues cause stress, so therefore contribute to the pain and stress cycle. This means that when we experience trauma, which takes its toll on us emotionally, it can also have physical effects. This doesn't make our chronic pain any less valid or mean that it's all in our head, as stigma so often dictates. All pain is created by our brains. Chronic pain is just as valid as acute pain or any other physical health condition. Symptoms of trauma, which can influence chronic pain. Patients with a history of trauma may experience a wide range of symptoms. Some of these symptoms can be linked to chronic pain, and many can have an influence on pain levels. Overly active nervous system. Trauma causes the nervous system to become overreactive, meaning that it is stuck in a state of stress and persistent arousal. When we look at chronic pain, we can see that the same overactivity occurs. Chronic pain changes our brain and nervous system. The nervous system becomes oversensitive, just like with trauma, and overprotective. This is called central pain sensitization. Central sensitization means that your nervous system is stuck on high alert. Like a faulty alarm system, it's sending out pain messages in reaction to perceived threats, even when no real threat is present. For example, allodynia is a symptom of fibromyalgia, which I really struggle with. It means that things which shouldn't cause pain, such as me scratching an itch, can cause extreme pain. So both chronic pain and trauma cause the nervous system to be overly active, which strongly links both experiences. Research into this link suggests that patients with a history of trauma may be more predisposed to central sensitization. Re-experiencing. Re-experiencing means that patients who have experienced trauma may relive aspects of their trauma. This is involuntary and highly distressing. It can involve re-experiencing certain aspects of the trauma, including the physical feelings, sights, sounds, and smells, or emotions of the trauma, as though they are actually happening again. This can come in the form of flashbacks or nightmares, among other experiences. When people are re-experiencing their trauma, they are taken back to that heightened emotional state again. Their bodies and minds are actively in that fight or flight mode as they try to face the perceived threat. This regular return to such a heightened stress response can cause and worsen chronic pain. Disturbed sleep. Patients who have experienced trauma often find it difficult to have a restful sleep. This is often due to the re-experiencing we've discussed. Those with chronic pain also tend to struggle with insomnia and non-restorative sleep. Lack of sleep can exacerbate chronic pain symptoms and make it harder for patients to cope effectively. Emotional numbing. Other patients who are experiencing the effects of trauma may start to withdraw and avoid social connections or activities. This may be because they want to avoid anything that could remind them of their trauma or avoid potential triggers, meaning things which could cause a flashback or a severe negative emotional response. This lack of feeling is called emotional numbing. This social withdrawal is also common in patients with chronic pain and become detrimental to both physical and mental health. Humans need social interaction to be happy and to stay healthy. Interacting with others to maintain our mood, to enhance cognitive functioning, and to gain support from others. When this is lacking, it can contribute to depression, negative perceptions of pain, and inactivity. Hyperarousal. Those who have experienced trauma may be easily startled, constantly on the lookout for potential threats, also known as hypervigilance. They may be very anxious and find it difficult to relax. These hypoarousal symptoms can cause very tense muscles, which can be painful and contribute to chronic pain. This state of hyperarousal also perpetuates the stress and pain cycle. Pain hypervigilance is a common symptom of chronic pain and can wire the pain response deeper. By being hypervigilant about our pain, we are feeding back to our brain that it should continue producing pain messages. Since those who have experienced trauma are already hypervigilant, they are more inclined to become hypervigilant about their chronic pain. Inability to regulate emotions. The same areas of the brain which regulate our emotions, form memories, and help us to focus our attention are also used for processing and regulating pain. So, you can see how chronic pain and emotions can directly influence one another. The inability to regulate emotions, particularly negative emotions, is commonly seen in those who have experienced trauma. These difficulties can lead to maladaptive, unhelpful coping behaviors with mental health and physical health. A great deal of research has shown that maladaptive coping behaviors worsen chronic pain and fuels the chronic pain cycle. These maladaptive behaviors can lead to health conditions being left untreated or self-management behaviors not being utilized. Depression and anxiety. Mental illness is common both as a result of trauma and as a symptom of chronic pain. Patients may not practice self-care or proactively manage their pain when they are in a negative mental state. This study on the link between PTSD and chronic pain explains that the biopsychosocial model posits that depressive symptoms can exacerbate or lead to increased pain and impaired function. This in-depth study on the comorbidity of PTSD and chronic pain states that anxiety is in fact the biggest factor in linking the two. The hyperarousal we discussed earlier and the increased risk of anxiety make chronic pain patients more likely to develop catastrophizing, and fear avoidance behaviors. As this study concluded, catastrophizing means that patients are more likely to think negatively and excessively worry about their pain, therefore contributing to high stress levels. Fear avoidance means that pain patients are avoiding activity for fear of worsening their pain symptoms. Withdrawal from activity can cause the body to become deconditioned and lose fitness. This makes it more painful when patients try to be active. For example, if you are used to walking and you've built up a level of fitness, but then become inactive for a long period of time, next time you try to go walking, you are likely to feel stiff and out of breath. The same can be said for any activity in life. If the body is not being used actively, it loses fitness. Damaged neural connections from childhood trauma. When trauma is experienced in childhood, both the mental and physical effects can last way into adulthood. The prolonged fight or flight state can be highly detrimental to a child's developing body and mind. This article from Harvard Medical School explains that when this response remains highly activated in a child for an extended period of time without the calming influence of a supportive parent or adult figure, toxic stress occurs and can damage crucial neural connections in the developing brain. Yeah, exactly. Adrenal exhaustion. When you are stuck in a prolonged state of stress, your adrenal system is producing a higher volume of stress hormones than it is designed to. These hormones include cortisol and adrenaline. Just like other areas of your body which become worn out through overuse, your adrenal glands can become exhausted. This can happen with both chronic pain and chronic stress, such as those with PTSD. Negative perceptions of pain. Those who have been through trauma are more likely to have a negative view of their future and their own abilities. This book on the effects of trauma explains, trauma can affect one's beliefs about the future via loss of hope limited expectations about life, fear that life will end abruptly or early, or anticipation that normal life events won't occur. Patients who are depressed or anxious are more likely to have negative perceptions of pain, such as feeling they are helpless and can't do anything to improve their situation. These negative pain beliefs have a significant negative impact on chronic pain management and pain levels. What treatments are available? Psychological therapies are available which can treat mental illness and deal with trauma. There are many psychological therapies which are also very effective for chronic pain. A multidisciplinary approach to treating both trauma and chronic pain can bring highly effective outcomes for patients, giving them relief from both physical and mental symptoms. Here are some of the therapies which may be suggested to treat trauma and chronic pain. Cognitive behavioral therapy, or CBT. CBT is a talking therapy which has proven results for both chronic pain and PTSD, as well as CPTSD. CBT can help to introduce more positive thoughts and, in turn, more adaptive coping behaviors to deal with pain and emotional distress. Through CBT, patients can change their way of thinking and feel empowered, ready to take control of their lives. This study concluded that integrated cognitive and behavioral techniques that simultaneously address symptoms of PTSD and chronic pain may help maximize effectiveness. Pain management programs. Pain management programs or clinics address the patient as a whole, implementing treatment approaches which treat body and mind. Psychological therapies are often an aspect of pain management programs. When these therapies are combined with more manual treatments such as physical therapy, symptoms can be markedly reduced. Mindfulness. Mindfulness is a great way to learn to reduce stress and regulate your emotions, and in turn to reduce your chronic pain symptoms. Guided mindfulness can give you the tools to practice mindfulness in your day-to-day life. This helps to keep your stress levels low and can help to deal with re-experiencing if you struggle with trauma. What can you do if you struggle with trauma and chronic pain? If you struggle with trauma and chronic pain, there are lots of ways you can help yourself. Talk to someone you trust. Expressing your feelings to someone you trust, whether this is a loved one or even using a helpline, can help you to feel supported and less alone. They may be able to help you in seeking treatment and to find better coping strategies. Seek treatment. There are a wide variety of treatments available for both trauma and chronic pain. The treatments we mentioned are just a few options. Talk to your doctor or specialist and advocate for yourself. You could seek treatment privately. You could access treatment for your chronic pain online through a chronic pain relief app like ours. You can even find psychological therapy options online to help address your trauma. Take your time, do your research, and pick the right option for you. So do your research. Learning how trauma and chronic pain influence each other and the science behind pain will help you to get a better understanding of how to manage your symptoms. Practice adaptive self-management. There are plenty of ways you can learn to actively reduce your stress levels in your day-to-day life. You can learn to manage your chronic pain and your mental health. Be kind to yourself. Don't be too hard on yourself. Learning how to live well despite mental illness and chronic pain is a delicate balancing act. It takes time. You will make mistakes along the way, and not everything will be perfect. Praise yourself with every step you take and celebrate your wins, even if they seem small. You can get through this and come out on the other side feeling stronger and more empowered. Yeah. See, I agree. And the thing is because of the way the brain acts, they've done a lot of research and they've got a lot of studies and information regarding how the brain develops in a different way and changes, especially the biggest area that really affects this is if you're experiencing childhood trauma. So you're in that developing stage where your brain, the the 0 to 5 age range, as they say, is when the brain has the most amount of learning and most amount of development required for a child for his future. So imagine, if you can, being at that age range and experiencing repetitive trauma, like chronic trauma, physical abuse, mental abuse, emotional neglect, and how your brain develops around that repeated trauma. So compared to someone who receives love and care and it never experiences neglect or any kind of abuse from their parents or from a loved one, there's going to be a difference in how the neurology of the brain looks between the two. And of course, that doesn't develop. Obviously, it doesn't cause chronic pain, but it can definitely affect it. If you are someone who is susceptible to injuries, or if you go out and you do a lot of exercise and you feel sore, you're in pain, just maybe you overdid it one time, there are ways that it can interfere or affect your ability to recover. If you're feeling negative and you're feeling down, or maybe you're having a trigger that day, it can definitely cause you to either not want anything to do with going out, and the pain that you're feeling it's truly emphasized, and it's a lot worse than if you weren't in that having that trauma. And you weren't experiencing any flashbacks. It would be a lot less severe. So there's so many ways that it does affect the human body, especially if they've experienced a lot of trauma, especially as a child. It's difficult to imagine for someone who's neurotypical and someone who has never experienced any sort of trauma in their childhood, or even as they're in their early years. They couldn't really possibly understand how it would be and how it feels, and the fact that they can affect each other. It's pretty alarming, and to be honest, it's quite incredible when you learn about it and you begin to understand how it affects each other, right? Yeah. So that's quite amazing. Okay, so now, when it comes to myself, when I was a child, I was kind of, I guess you could say, I grew up feeling, not necessarily in my early years, I never really had any injuries or any physical ailments up until I was about 12 that really kind of made any serious changes to me or held me back in any way, as far as movement or physical ability. And it wasn't until when I was 12 years old and I really had a very extreme growth spurt and was diagnosed by my doctor with Osgood-Schlatter's disease, which is where the bones, you grow too fast for your bones to, basically when you're growing, your bones are separating and it's how do I explain this? When you stretch something, the molecular bonds in the whatever you're playing with or you're using, they kind of readjust in order to stay together, right? Because it stretches and it thins out a bit. So when your bones are growing, it's almost like they're breaking, but they're not really. There's a growth plate in the bone, in all your bones that are growing, like in your legs, your femur, in your bones on the calf area. Forgive me, I don't know the names of the bones, so you're just gonna have to go with the layman terms. But all the bones in your body have growth plates, and when you grow, And when the bones begin to get larger as they're growing because of that, every time they get a little bigger, they re-heal. Like they heal in that area, and then you keep growing. So it's like a cycle, right? You grow a little bit and the bone heals. You keep growing and the bone heals a bit more. And so you do that up until the point where your body decides that it's completed its growth cycle. Well, I had it where I grew so fast that the growth outgrew the healing process. And so I had degrading of the bone structure in the growth plates and like all the weighted areas. I had to be careful on all the weighted areas of like so like my hips, my knees, my ankles, the joint, like the joints especially, because that's where all the growth plates are. And I had to be careful because if I was rough on my body, and you could cause damage and it would be permanent. So you had to be very careful while the healing process in that time frame was, making up for the rapid growth that I experienced. So I had that, and then I had my back get severely injured. And then a couple of years later, I seriously injured my neck, and all of this was sports related. The growing thing was obviously not sports related, but it did affect my sports that I was playing. And so I often have days where I feel pain, like it's not like, how if you break your arm, and I really hope that you haven't, and I have not either, but they say when you get hurt or you have a severe injury, it's extremely intense and it's very sharp, and it's very like you could a lot of times you might feel like you're going to pass out because it's so strong and it's so intense. The pain receptors are really overactive in that moment. Well, the difference is that it's not an intense pain, and it's not sudden, and it's not like overwhelming. It's like I wish I could explain this to you guys in a way that would make sense, but when you're having very mild and very subtle pain, it still hurts. It just doesn't feel like it ever goes away. Like it feels like it's constant. It's a constant, mild, subtle pain, and it can cause a great deal of discomfort. It could affect your ability to sleep, like it does for me. I could wake up in the middle of the night, or I could be moving. I constantly at times move if I'm trying to sleep and I'm not super tired, because my body's always aching. I can have headaches. I can have neck pain. And when I'm feeling stressed or I'm feeling anxious, and a high level of anxiety, my body will pick up on that. And I'm not saying it's like I'm anxious, oh my God, I feel like I'm in pain. It's like your body wears out, and you can only handle so much before you start to feel worn down, or you feel sore, or you feel pain. Because it's only so much time or so much amount that it can handle before it's too much, right? It's like anything. Eventually it's going to break, or eventually it's just going to get to the point where it can't handle it anymore. So the anxiety and the trauma, or the stress from the trauma that I'd be feeling, it would even after like later that day, after I've recovered, or I'm not feeling the trauma anymore, and I'm calm and I'm grounded, I can feel more tired and more pain, more like in pain and achy than I would have if I wasn't feeling it. If I wasn't in that trauma state and I wasn't feeling the anxious feelings that I had. Now the thing is I often feel anxious feelings and get triggered. So when there are days that I'm not feeling it, or I don't get triggered, or I'm not feeling anxious, it's unusual. It's not a very common feeling to have my body feel in a really good shape, like feel really calm and really in tune with it, with everything, because of the amount of times during a day or a week that I'm feeling the high levels of anxiety and the triggers, of course. So yeah, it makes me feel worn out so much faster, and I'm tired. And if I've had a lot of stress during the day, whether it's from work or personal reasons, it's like I'm done. Like, you get home and it can happen super quick, right? You just, within minutes, your body and your mind stops working hard, and your focus level drops, and you're just, you finally have a sense of calm, and then the body just goes, and it's done. And it happens so quick. You've got that energy, and then you don't, and you're done for, and you feel super tired. And if you're hungry, it doesn't help. It makes it way worse, because there's no energy, there's nothing to burn, no calories to burn to help fuel the body. So you feel tired, and you feel like you got to have a nap. And if I've had a bad night's sleep and I have had a lot of stress during the day, I can have a nap for a half hour or an hour amazingly, and kind of feel rough for the rest of the day, because it seems like my body doesn't fully recover. And it sucks, because especially if you have plans, or you have things that you want to do, and you feel like it's important to get them done because you want to maintain a schedule, or you want to keep your place looking clean, or you have tasks that you need to get taken care of, you have a deadline. It affects your ability to do it properly, or even take care of it at all. And so it gets in the way of living your life, basically. And that's not fun. It can increase the stress levels and anxiety, because now you start feeling you can feel upset about the fact that you're not getting things done that you want to, or you start to feel upset and wishing that the stress, or the cause of the stress, or cause of your anxiety or triggers would just go away, would leave you alone. Those sort of things you don't want to deal with anymore. And if it happens multiple times in a day, you get into the point where you're in your mind, you're saying enough, just, I don't want this anymore today, leave, go away. Or all you want to do is just go jump in your bed, or take a bath, or go for a long, slow walk, and just try to forget about it, right? To not think about it anymore, because it's doing nothing but damaging yourself. It's causing your body to feel like crap, and mentally you're just not all there, and you can't feel any positive emotions, any positive feelings. It's nothing but negativity inside you. It's no fun. I experience it on a regular basis, both personally, professionally. A lot of it, a good majority of it comes from my trauma. I seem to feel anxious a lot of times. I'm quick to get worried, or quick to get paranoid about stuff, and so much of it is trauma related. So it sometimes doesn't take very much at all for me to be in that state of being. And if you're having a bad day to start, it can really take away from your ability to do anything at all. And a lot of times you have to force yourself to get going at what you want to do, even if you are feeling it. So sometimes you have to fight that chronic pain and that worn out feeling, that exhaustion, just to get to, because you have to, you don't really have a choice. And so that doesn't help. That just makes things worse when you're done. And at the end of the night, you're so tired that you just feel like sleeping for a whole day and not showing up for work or not taking care of things, but you have to. You have responsibilities. You just can't stay in bed and say to hell with it. I wish we could. I'm sure there's a lot of you out there who have done that, right? Like, you just have said, to hell with this. I'm not getting out of bed, or I'm not doing anything today. I don't care. You grab something easy to eat. You sit and you watch TV all day, or you just lay in bed and do nothing. Or you go outside, sit in a chair and read a book, or you nap off and on. Like, I'm sure that's been a consistent method of adapting to the chronic pain and the stress that you are feeling on a regular basis. I can imagine. So I've had days like that where I've really wanted to just stay in bed or go outside and lay in my hammock for the entire day and really do nothing. But I really can't. Like, as much as I want to, there are things that I do need to do. And maybe someday I won't have to worry about those kind of things and not let it get in the way of having a do nothing day. I would love it, but it's the reality today is that just is not possible. Gotta be strong sometimes. Okay, well, that's it for today's episode. I hope this was informative, and I hope that you got something out of what I read. And I realized that there's a lot out there regarding chronic pain and trauma and how it affects us. So there's research out there you can find. If you want to contact me, if you have any comments, if you have a suggestion for the show and you want to get in touch with me, there are a few different ways. You can talk to me through Twitter. The handle is at ADHD and CPTSD. You can email me. My email address is livingwithadhdandcptsd @gmail.com. You can go to the website, livingwithadhdandcptsd.ca. And I would be more than happy to hear from you, and I will definitely respond back. I am open to having great conversations, and I would love it. If you'd like to be a guest on the show, you can contact me as well, and we can look into that and see what works best. All right. Become a subscriber. I have a lot of bonus episodes and material that's available only to subscribers. You would also get early access to all the new episodes that I put out every week, and it's really not all that expensive. It's for North America, it's only $1.49 a month or $13.99 for a year's worth of subscription time. You do get a 7-day free trial as well. If you really find this podcast to be extremely informative and helpful, then I recommend doing that and getting extra material. That would be great for you. If you want to donate, you can go to ko-fi.com. That's ko-fi.com/livingwithadhdandcptsd and CPTSD. All right, everybody. I had a great time talking about this. I hope that you guys are really into these, and let me know. I would love to hear from you. And then we can chat or figure out some new episodes together. All right. Have a great day, and I will talk to you next week. Bye, everybody.